Maddie suffered from a very major life-changing traumatic experience. Unfortunately, Maddie and his family suffered from a house fire in which they lost Maddie's brother and their son.
The fire burned out of control sometime after 8:30 in the morning, but it started much earlier. Embers from the fireplace spread to furniture and Christmas decorations. The result was a living room quickly engulfed. The two young adults who started the fireplace fire were able to make it out of the home safely. They also rescued Christopher Miller's older brother, Mathew, who suffered serious burns to his hands and arms.
Mathew had extensive burns. Patients that have extensive burns need intensive rehabilitation. He had burns covering 60 to 70% of his body surface area. He was initially treated at Cornell Burn Center, going through multiple surgeries, preparing him to come to inpatient rehab here at Blythedale. Once he got here, it was a race against time to try to prevent the scars from contracting down and limiting his range of motion and thereby handicapping him.
Mathew's wounds were so complicated that they required twice-a-day dressing changes that lasted longer than an hour.
The day hospital program was a perfect transition for Mathew. It provided intensive therapy, school, and a means for getting him home sooner.
Blythedale's day hospital program is really a partnership between a hospital and a school district. So our day hospital program really provides something that no one else has in the same way. Children can be at home. They can live with their siblings, with their parents, with the rest of their families, and then they come in a school bus or an ambulette or even in a personal car every day to school. What's different here is that they can get all of the medical treatments they need, whether it's physical therapy, speech therapy, occupational therapy, or medical treatments, feedings, antibiotics, at the same time that they're able to go back and forth to a classroom.
Blythedale Children's Hospital is the only hospital in the state of New York that has its own public school district.
My goal with students like Mathew is to make sure that when they first come in that they're comfortable, that they're getting what they need. When we start talking about them going back to their school, then we really focus on, okay, what does this child need academically?
And picture a diagram of the life cycle, all right? So what we're gonna see, what I'm gonna show you in a minute, is the dormant cyst.
Once the children come to the school program, they are in school learning while they're here, but their main priority is their therapies. And so we will go down to school and pull them from their classes.
Bye. When you have extensive burns, you need intensive therapy. Mathew was an athlete. This was a kid who toured the country with his team and hit 76 home runs before he sustained his injury.
Is this gonna be ready? Really?
We assess basically what the child's needs are. What were they doing before? Were they able to dress themselves, feed themselves? Were they involved in any activities in school or after school that they would like to get back to? So we assess the whole child. We definitely interview the family as well. And from there, we try to do whatever the child was doing before. We work towards getting them back to functioning. The goals were to improve his skin integrity, to improve his range of motion, to improve his ability to feed himself, dress himself, bathe himself.
In addition to the medical challenges that Maddie was forced to face after he received the burns in the fire, he also was faced with all of this grief. He needed to figure out how to process that while in the hospital recovering and receiving therapy and sort of trying to stay strong and stay focused and positive. Meanwhile, there was this back piece of everything that he and his family were faced to deal with.
As we look at how a child progresses, we're looking at the physical, but we're also looking at the mental. And what the day hospital provides is a coordinated effort between schooling and physical medicine to be able to put the two together and make sure he gets the best of both worlds.
We have to look at the child as the whole child, not just one aspect, so that we are providing exactly what the child needs.
Having a social worker assigned to each child is incredibly unique in a hospital setting and shows the value that we have for our children and families and the support that they need.
Unlike an adult, children are still having ongoing development, and that development requires socialization and exposure to things that will test their mind and give them experiences that they'll grow from.
Kids are kids here, and that's always the most amazing thing. They have the same issues other kids do. They talk about music and clothes, and that just feels very normal around here.
These are children who often have very complicated medical needs and just would not fit well in a mainstream school. The children come here and they're with their peers. It allows them to do the other aspects of their development, which is learning how to grow up as a person, how to become independent, learn how to socialize with people.
Hammurabi's Code, right? Hammurabi's Code is Congress, okay? The legislative branch is Congress.
I practice on the weekends and 4 days during the week.
You are so dedicated.
Yeah. Well, I want to show you a video.
Sure.
Me playing baseball.
You playing ball?
Yeah.
When was this?
This was yesterday.
Awesome job. That's great. My role was to provide Maddie and also his parents a safe place to process what had happened, to talk about Maddie's brother, to go through old pictures, to really be that person that can hold that for them.
Our job here is to help them come to terms with their new normal and what life is going to be like now, and help that child meet their most potential, and help the family determine what the best next steps are.
Couldn't you like time it?
Just like a timer. Do you have your timer?
Yeah.
Matthew's done really, really well. He's done more than I could have asked for him to do. He's really, taken initiative and really stepped up to the plate as far as his recovery and doing all his therapies and all his exercises to really get back to his main goal, which is sports, especially baseball.
After I met Allie with her physical therapy working on me, I noticed that all my scars are going away now, and I hope to continue back to my regular life again.
With all the therapists here, I think we've done a really, really good job at getting him to where he needs to be pretty quickly.
The work we do here is really life-changing for these kids. These are kids that are in a situation that they and their family had not planned to be in. Whether it's an illness or an accident, it was never something anybody envisioned for themselves.
All of our students are transitional, which makes us very different. So we always have our eye on where the children will be returning.
So when a child leaves here, it's a wonderfully happy day. As much as we miss them, it's a great step for them in their lives. They're graduating on to a placement in their community or another program and able to integrate back with their peers and with the rest of the community. So that's a wonderful thing.